Hi, I'm Dr. Buck Weaver. I'm a neuropsychologist and director of the Weaver Center here in Wayland, Massachusetts. And as you know from my previous videos, we always like to talk about things that people have asked me to talk about. And most of you that have seen these before know that I've had a long diagnosis of dyslexia, attention deficit, and some memory issues that I struggle with. And certainly organization's been tough, but I've overcome a lot of that by having a clinic where people can tell me how best to manage my own difficulties. Well, one of the questions that comes in more often is, what about impulsivity? Impulsivity is considered in many ways a very difficult thing to treat. And impulsivity is where a child does something, says something, reacts to something in a way that's not appropriate to the situation. We kind of joke about that sometimes as, most people do ready, aim, fire. Well, a lot of our kids do ready, fire, aim, or fire, 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 fire. Maybe aim, maybe think about it. So we've always tried to use strengths in terms of helping people with impulsivity and attention deficit. And although medicine can be very helpful with reducing impulsivity, it's not always helpful. And our kids get in trouble all the time. Might be lying, might be punching, might be saying things inappropriately, blurting out in classes, bothering a sibling, and then the parents say, stop doing that, and the child stops for a little bit, but then does the same thing hardly any moments later. And so it creates a lot of conflict. And mostly, I would say, kids do not want to be in trouble. Our kids do not intend to be in trouble. But when everyone looks at our behavior, what we say and what we do, and it's impulsive and inappropriate, anyone that's looking on is going to think they must be doing this on purpose. How can you say stop, and then it starts right away? If I were doing the same thing, the observer, the parent, the teacher, whatever, I would never do this again and again and again. So impulsivity can be a real problem, and also for self-esteem. Kids feel really badly when they're in trouble a lot of the time, especially when they never intended to be, right? So the treatment of impulsivity is, as you all know, the Weaver Center uses strengths to help young people develop strategies that help them manage their own difficulties. Our kids don't always develop strategies. In fact, I sometimes think this is a strategy deficit, because they often can use strategies very well, but they don't develop them. For example, I'll use the name Henry. Adolescent, 15-year-old kid, in trouble a lot in school, and yelling out in class and fooling around and not paying attention and being distracted and being impulsive. And when he goes down, talks with the principal because he's out of class a lot of the time, that one-on-one conversation might be very pleasant. And the principal might be saying, oh, what's wrong? Why are you doing this? And almost always the answer is, I don't know, or I'm not sure. Or one of the things that we do all the time is we make up a lie, because we can think of a lie faster than we can think of the truth. So that can be part of being impulsive. So let's say, if it was Henry, I can't remember now. Sorry, part of my memory issues. But let's say we're working with Henry, and I know from my own experience and working with folks for nearly 30 years, there are times when impulsivity in one's mind, there is a little bit of a, maybe I shouldn't do this. Maybe it's not right, but it's very fleeting. It's very weak in terms of volume. And usually it's quickly overwhelmed by, like, yeah, let's do it. Yeah, this will be fun. I won't get in trouble. Boom, if there's that kind of thinking at all. So with Henry, as you know, we use strengths. And one of his strengths was he loved to make beats like rap beats. It's one of the things that he really enjoys, and it's all online, and he's got these really great beats and so on and so forth. And he's always got his favorite, and it's new ones that he's developed. And so we talked about, Henry and I, about associating a beat or a set of beats with that small little voice that comes up infrequently, but it comes up as a little bit of a, maybe I shouldn't do this. But hearing with loud beats, that getting louder and louder and louder, and ability to associate that with stop this, stop this, stop this, think about it. But through the beats, because that's high interest, through the beats, it gives him a little bit of time to think through things, right? And so what's been very interesting is, which we find all the time, when you use a high interest a skill, cognitive skill, to manage something that's a cognitive deficit, right? That becomes something that the child actually enjoys because they don't like being in trouble, but they don't think about it beforehand. So now this guy's got beats, and he's got different beats. And when there's things that are going on and he knows judgment, 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 right? Now what's interesting is even things that he never even thought about having a little bit of stoppage in his own mind are coming up more and more and more because he's gotten used to loving these beats, having better judgment, not being impulsive, thinking through things more, and not getting in trouble. And people are amazed that he's worked so hard on this, and something that was a hour by hour problem, certainly a day by day problem that got him into a lot of hot water. He's now feeling totally in control of his impulsivity. And if he slips or makes a mistake, it's in the context of him not being impulsive anymore. And he is very comfortable now saying it was a mistake, it was my fault, which you don't always get. Usually there's blame that's involved, but no longer. He's very, very healthy, very successful, and strengths is the answer to success. We just need to find them and use them and develop strategies and give people the opportunities to solve their own problems with their own strengths. Gotta love it. If you have any questions, please don't hesitate to email me, rweaver@weavercenter.org, and I would be very happy to get other questions and respond in ways that we have found to be most helpful when it comes to treating kids that are pretty much in trouble all the time, even though they're great kids. All right. Good luck. Thanks. Have a good one. And I appreciate you listening.